I am from small town South Dakota. I grew up in Lenox, which is 20 minutes from here, and then I went to medical school at University of South Dakota and did the rest of my training at Mayo Clinic in Rochester. I wanted to become a doctor in the first place, really based on my family history of cancer. All 4 of my grandparents had cancer. Some of those scenarios did not go well as far as the communication to us as the family about what we were up against and how much time we had with our loved one. And so that was really a motivating piece for me to try to get involved and actually try to help learn more about cancer and be a good communicator to my patient and the family about what we have in front of us and educate and walk with the patient and their family the whole way. How I like to think about things is I'm very methodical in how I approach medicine, and so internal medicine fits where we're doing adult medicine, touching on a lot of different systems, and then oncology has a lot of internal medicine in it, as well as a lot of palliative medicine and a lot of research, and so it's a very exciting field that I still really love. I think we're at a really exciting time in oncology that we have more medicines approved for cancer by the FDA than in any other specialty. And so research has really made great advances. Even in the 15 years since I left fellowship, our treatments have changed significantly. And over the years, I've come to figure out that I really enjoy reading about and learning about and taking care of patients with GI cancers, which means anything from the food pipe down through the stomach, the pancreas, the liver area, and through the colon and rectum. And so those cancers are the ones that I have chosen to focus on in the past couple years. I think that's beneficial to patient as our group has gotten big enough that we can take a subspecialty lead in these areas so that is us dedicating time to become expert at the updated data, the guidelines, what research is coming through. And we try really hard to go to national meetings, bring back practice-changing information back to our team, and lead the way in recruiting clinical trials to Avera, which give our patients opportunities that they typically would not have had in the past. And so I think your patient gets expert-level care in a community center, which is an amazing opportunity that they don't necessarily have to travel to the coast to get expert-level care. Oncology is an emotional specialty, and I actually love that about oncology. I am not afraid to engage with patients and their families, and I really want to get to know them and they to get to know me and really understand their goals with treatment. And my job is to be very honest with them about what's in front of them and the goals of treatment and how it usually goes, and to try to help them do as well as they can for as long as they can. And sometimes that means that patients do really well and graduate from my clinic, and we celebrate that. And sometimes the treatment does not work and the patients do not get to graduate from my clinic. But either way, I find great worth in being honest with patients and getting to know them and walking with them. It's such a privilege to be let into that sacred space. And so I really, really love that. And I think that's why I will love it forever.